Hey there, everybody. Thanks for joining us. We start tonight with a controversial bill facing lawmakers in Augusta. Today, they heard testimony on the proposal. So why is it controversial? Well, it looks to reduce restrictions for licensed needle exchange programs in the state. And it comes the same day that a new program opened in Lewiston to help those dealing with addiction. News and Rain's Sean Stackhouse takes a closer look.
These are fentanyl test strips.
Carrie Morissette says these strips are just one of the many resources that will be provided to those battling substance use disorder at the Church of Safe Injection site in Lewiston. On Tuesday, the organization opened its first syringe exchange program.
We're just trying to keep people safe in case one day they do decide to find their way into recovery. They can do it healthy without having barriers.
This state-approved site will provide things like sterile syringes, alcohol pads, naloxone, and referrals for HIV and hepatitis C testing. It's also a syringe exchange location, something Morissette says wasn't around when she was using.
When I was an IV drug user, syringe service programs were not available where I was, and now I'm a person living with HIV.
The Church of Safe Injection was first founded by recovery advocate Jesse Harvey, who began by simply handing out clean needles to those in need from his car, even when it was illegal. In 2020, he lost his battle with substance use and died of an overdose. His mother says finally having a licensed physical location is the culmination of her son's work.
This is where his vision and his dream is coming to fruition, and I couldn't be prouder.
The discussion around syringe exchanges isn't just happening here. A bill before lawmakers in Augusta looks to reduce restrictions for syringe service programs by ending a rule that requires all syringes distributed be exchanged for used syringes.
That allows registered participants to receive the care and supplies they need to help prevent life-threatening diseases and lifelong illnesses.
The bill's sponsor, Representative Genevieve McDonald, said during a public hearing on the bill Tuesday, she plans to introduce an amendment that would allow the Maine CDC to limit the number of clean syringes provided by a certified exchange. While many spoke out in support of the bill, others fear it could increase needle waste. Portland Mayor Kate Snyder testifying neither for or against the bill, but says the city has collected more than 10,000 needles in the last year. Nearly half were not disposed of properly.
Portland residents regularly encounter needles on the shoreline, in parks, on trails, and on the sidewalks.
But as the state sees a record number of overdose deaths, those with the Church of Safe Injection are hopeful this is a first step to not just prevent illness, but get people into recovery.
They feel comfortable with us and they know that we can help. So when they do become ready, if they become ready, we're usually who they turn to.
Sean Stackhouse, News Center, Maine.
Now, that bill is still in the very early stages of the process. The Church of Safe Injection says it plans to bring syringe service programs to Westbrook, Bethel, Rumford, and Dixfield.